I think, especially here at MUSC, we have such an incredible group of surgeons and a unique and diverse group of pediatric anesthesiologists who trained all over the country. So we have a lot of perspectives on different ways to do anesthesia that are all safe, and we have excellent communication with our surgical colleagues. So it's always a constant dialogue between the anesthesia team and the surgery team beforehand, actually throughout the entire perioperative journey beforehand, when patients are getting ready for surgery, especially in the operating room, and then when patients are recovering. We always have a clear line of communication, and the team that we have here at MUSC is so fun to work with, and there's such good high quality care that we're providing here as a collaborative group. I think having first and foremost board certified pediatric anesthesiologists is huge. We undergo extra training and have a board certification specifically in pediatric anesthesia. So having someone who is extremely knowledgeable and capable taking care of your child should be one way to provide confidence to parents, and then also reduce anxiety about when they hand over their precious cargo that we are well trained and can take care of your child. In addition to that, we also have pediatric cardiac anesthesiologists, so that's beyond our training as the general pediatric anesthesiologist, and they primarily take care of any of our cardiac children having heart surgery or non-cardiac general surgery. So knowing that we even have more highly subspecialized anesthesiologists should be another important factor. And then all the things we talked about in terms of the design of our hospital, with our pre-op area being very spacious and fun, are the flow of how you get from the operating room to PACU, where it's also individualized bays. Like, it's just a very unique experience for patients. We also have the ability, when it's appropriate, is deemed appropriate by the anesthesiologist taking care of the patient, that we can bring parents back to the operating room with us to go off to sleep as their child's going off to sleep. So at our campus in North Charleston, Semi-Medical Pavilion, we have specialized rooms where we actually go off to sleep in those rooms that are not operating rooms. They're specifically designed to go to sleep in, and parents are allowed to come back with us. And that part is nice because they don't have to dress out into scrubs to come back, and we can bring more than one parent back typically. Again, this is all up to the attending anesthesiologist's discretion, but we do provide that for appropriate patients to have the parents with them for going off to sleep. Here at the main hospital, we can bring parents back into the OR again if it's appropriate, and this does calm a lot of patient anxiety, so much so that we may not even have to use medications or other distraction techniques if parents are calm and are doing a good job consoling their child. So in addition to all of our child life specialists and great resources in our holding area, our board certified anesthesiologists, having unique things like bringing parents back to the operating room can make it a really satisfying experience for parents.